Welcome to today's Explainer. I'm so thrilled you're joining us. Today, we're tackling a topic that honestly can feel like a giant, intimidating puzzle. But don't worry, we're going to decode it together. We're looking closely at the complex U.S. healthcare system, specifically focusing on how the whole shebang works for those who have immigrated to the country. Whether you're navigating this for yourself, a family member, or just want to understand the system better, you are exactly where you need to be. We'll be breaking down the rules, the costs, and the benefits into clear, actionable steps.
Okay, let's dive right into this. Navigating the US healthcare system can feel a bit like reading a map upside down. And let's be real, when you add immigration status into the equation, it can feel incredibly overwhelming, like you're trying to read that upside down map in the dark. But hey, that is exactly why we're here today. We're going to turn that map right side up. We'll draw a clear route from understanding basic eligibility all the way to figuring out the exact benefits you can receive.
So, here's our route for today. First, we'll look at navigating the healthcare map, then pathways to eligibility, upfront fees and buy-ins, monthly costs and premiums, and finally, what the benefits actually are.
Let's start with our first stop, pathways to eligibility, and finding your starting point on this map. The federal guidelines break Medicare eligibility down into very specific pathways, completely based on a person's legal status and their U.S. work history. There are three primary categories we need to understand here. First up, we have lawful permanent residents, which you probably know as green card holders. Second, naturalized U.S. citizens. These are immigrants who have completed the full naturalization process, meaning they're treated exactly the same as natural-born citizens under the law. And third, undocumented immigrants. Currently, the law states that individuals who aren't lawfully present in the United States are legally barred from enrolling in federal Medicare programs.
Now, regardless of whether you're a green card holder or a naturalized citizen, there's a universal starting line for eligibility, and that is age 65. Reaching your 65th birthday is the primary milestone that actually triggers your ability to enroll in the Medicare program.
So the crucial point here is this very specific number 5. If you're a lawful permanent resident, just turning 65 isn't the only requirement to qualify for Medicare. You must have resided in the U.S. legally for at least 5 continuous years right before enrolling. This 5-year residency requirement is a strict federal rule, so mapping out your exact timeline of legal residency is absolutely vital before you apply.
Moving right along to upfront fees and buy-ins, let's understand the initial tolls on this road. First off, you can breathe a huge sigh of relief. The application fee is absolutely $0. The Social Security Administration and the Centers for Medicare and Medicaid Services do not charge any processing fees or administrative costs just to file your paperwork. Getting your application in the door is completely free.
Now, what's really interesting to note is this buy-in requirement, because this is where the road gets a bit steeper for newer immigrants. The primary financial hurdle here is often a lack of U.S. work history. You see, most lifelong U.S. citizens get their hospital insurance premium free simply because they've been paying Medicare taxes out of their paychecks their entire working lives. If you're an immigrant who just hasn't met those specific work thresholds yet, you are required to pay out of pocket to essentially buy into the program.
Next up, monthly costs and premiums. Let's calculate your route. To calculate those ongoing costs, you really need to understand the fundamental metric of the whole Medicare system, which is work quarters. Think of work quarters essentially as credits. You earn them by paying U.S. payroll taxes over your lifetime. Every time you work legally in the U.S. and pay taxes, you accumulate these quarters, and they are literally the single biggest factor in determining what your monthly Medicare costs are going to be. And here is the magic number, 40. Earning 40 or more work quarters, which translates to roughly 10 years of working in the United States, is the golden ticket. Hitting this milestone unlocks premium-free hospital insurance, which significantly lowers your overall healthcare costs in retirement.
And this brilliantly illustrates what can sometimes feel like an alphabet soup of jargon. Let's act as a translator here. Looking at Part A, which covers hospital insurance, if you have those 40-plus quarters, your monthly premium is $0. If you have between 30 and 39 quarters, your premium is partially subsidized, meaning you pay a reduced rate. But if you have fewer than 30 quarters or 0 U.S. work history, you're going to pay the full out-of-pocket premium for Part A. Now, look at Part B, which is your general medical insurance. Everyone, regardless of their work history, pays a standard baseline premium for Part B, which can scale up if you happen to have a higher income. Then we have Part C, known as Medicare Advantage, and Part D for prescription drugs. Both of these are optional private plans, and the costs for these vary depending on the private provider and the specific medications you take.
Speaking of Parts C and D, there is a very important update as we look toward 2026. Private Medicare Advantage or Part C plans are highly competitive right now, and the vast majority of beneficiaries have access to multiple $0 premium options, though keep in mind you do still have to pay your baseline Part B premium. Furthermore, thanks to structural updates from the Inflation Reduction Act, there are now strict annual limits on out of pocket prescription drug costs under Part D. This is a massive protective measure to shield seniors from catastrophic, unexpected medication expenses.
Finally, let's look at what are the benefits. Finally, let's look at what are the benefits. We are arriving at your healthcare destination.
And here is a wonderfully reassuring fact. It's a very simple equation. Eligible immigrant benefits equal U.S. citizen benefits. Once you successfully navigate the map and enroll in the program, the benefits provided to eligible immigrants mirror exactly those provided to any natural-born U.S. beneficiary. There is no second-tier care here. You are fully in the system. So let's break down what that care actually looks like, starting with Part A, your inpatient care. This covers the heavy lifters of healthcare. We're talking about acute hospital stays when you're admitted overnight. It covers care in skilled nursing facilities if you need rehabilitation after surgery. It provides for hospice care, and it even covers foundational, medically necessary home health services.
Moving on to Part B, this is your everyday outpatient care. This covers your routine doctor visits and crucial preventative care, like vaccines and health screenings to catch issues early. It also covers ambulance transportation in emergencies and durable medical equipment. And by that, I mean things you might need for everyday life, like wheelchairs, walkers, or oxygen tanks.
Now, let's move forward and see how this builds with supplemental and prescription care. You see, original Medicare, Parts A and B, doesn't cover absolutely everything. That's where Parts C and D come in. Part D is dedicated entirely to your brand name and generic prescriptions. Part C, or Medicare Advantage, is a bundle. It takes Parts A, B, and usually D, and packages them together through private insurers. What makes Part C incredibly popular is that it frequently adds supplemental benefits that original Medicare completely ignores. I'm talking about things like routine dental work, vision checkups, and hearing care. Wow, we've covered a lot of ground today. From the 5-year residency rule to that magic number of 40 work orders, we have literally turned that map right side up. But the journey ultimately depends on your specific circumstances. So I want to leave you with this question to reflect on. How will your U.S. work history and your specific immigration timeline shape your personal Medicare map? Take the time to evaluate your quarters, check your timelines, and prepare for your healthcare journey with confidence. Knowledge is your best compass, after all. Thank you so much for joining me on this explainer today.